Hello.
Hello.
How are you?
Very well. Hi, Dr. Emer. How are you?
I'm in my in-home studio, going live with you today. It's great. I'm excited. We have a
Wonderful.
lot of inquiries on my Instagram these past couple days, especially when I did the micro rolling protocol on my skin. Almost everybody is asking what I'm doing to stay young, and so I'm excited today to talk about your guys' science because people don't really understand. The first thing they see when they see a product is how expensive it is. That's what
Yes.
they say. So they see your products and they go, wow, those are on the higher end of some of these products that are out there.
Right.
So I wanted to kind of go through that mystery with everybody today and talk about, why I use the specific products that I do and we promote, and then also talk about yourself and your line, because we're going to put this on our IGTV and our YouTube to get people real interested. Our emeragecosmetics.com website, we've been following analytics for a while, and one of the pages that gets the highest viewed but a little bit less in sales is your guys' products, because I think that people don't understand them a lot. Once we explain it and we put it as part of our protocols, especially for healing, thank you guys so much. The skin glow that you see is a combination of ingredients, and these specifically the dual skincare product, the accelerator and the serum, have in it almost everything you basically would need: retinol-like alternatives, bakuchiol, vitamin C, hyaluronic acid, and also your anti-aging peptides, stem cell growth factors, and cytokines. So you're getting it all. Even if you do only those two products, you're pretty much getting almost everything that you would need, which is what I want to talk about. But the reason I brought that up was I think in this marketplace where there's mass products like Glossier and Kylie's Skin and Drunk Elephant, which are really inexpensive, people don't understand the difference in a high quality medical grade preventative and actively treating serum. So how do you want to start?
Yeah. Well, let's start where you just landed. What's the difference between an inexpensive, product that is packaged great, has great marketing behind it, celebrities behind it. It sounds fantastic, and you can get it on the in the drugstore for $20, right?
Right.
So what's the difference? Well, the difference is some of those ingredients, we do share, right? We have vitamin C in many of our products, and you can get vitamin C products. Now, the quality of vitamin C and the dose of the vitamin C can be very different. And so you
Huge
can have a
difference
product
all
that
aboard.
says vitamin C, but is it the proper form that's least irritating, most effective, and in an appropriate dose? So that's one factor. But let's jump right to what's really different in Antiage. It's the stem cell derived growth factors.
Yeah, and this is the key. When you say the word stem cell, everyone jumps to it.
Yeah.
And when I started using stem cell and peptide growth factor products many years ago for laser to help healing, people thought I was out of my mind. So tell them what I was thinking about years ago, and that's now become popular. Why is it key to have these therapies, especially in a high quality ingredient list, in a high quality product?
So stem cell growth factors are a class of ingredient. They're these little proteins that our body uses naturally to talk between cells. They're like text messages from one cell to another. And that's why your skin looks so great. In part, you do a lot of good things to take care of your skin. One of them is you're putting these very youthful, childlike growth factors on your skin every single day.
I'll be okay with childlike and youthful skin, no problem.
Exactly. And what happens is as we get older, you and I are both in our 30s and heading towards 40, right? So
You're aging me now, but yeah, I tell people I'm gonna be 40 this year.
Yeah, and so as we age, we lose the natural ability to produce these growth factors. And so what we're doing in this medical grade skincare that you can't go get at Target is we're putting back these natural human proteins that are text messages between cells that tell cells to behave more youthfully. More youthfully means less inflammation, less prone to scarring, less prone to wrinkles, and it produces a natural glow. There's a healthfulness that is almost hard to put your finger on sometimes, but it just looks healthy when you have lots of these youthful proteins in your skin.
Yeah, and let me tell you, always Shanna Marie is saying that her husband, she started the product, and after 2 weeks, and I'm not sure if she used both the accelerator or the serum, but I think you should use both together. And my husband started noticing her face was firmer. One of the things I always tell people, remember, as you age, you start to get laxity. And you get laxity in your skin and crepiness from various ways. Some of the ways is volume loss. That's basically the foundation of the house. Can't treat that with skincare products. But you can make the house and the tent over the house stronger by building collagen, helping elastin, and the turnover of your skin, making it healthier and more strong. You know that when you get injury, you want to heal more quickly, but as you age, you don't. So we need to keep your skin young by doing these, using these specific type of products that have human-derived stem cell growth factors and cytokines, that have a combination of anti-inflammatories in there, as well as antioxidants and hydrators. You're pretty much adding it all to make the skin more youthful. So you're gonna look firmer. The skin's gonna look more clear. It's gonna be tighter. It's gonna be softer. The pores are gonna be shrunk inside. And the growth factors they're asking about where they come from, they're human-derived bone marrow stem cell growth factors. Can you talk about how you get these? Because I know people get freaked out when they hear stem cell.
Yeah, absolutely. Human and stem
Exactly.
cell.
They think you have a room where people are, hooked up to something dead, and you're just taking pieces of them all day.
Right. So this technology, like you said, you used it years ago for recovery from laser. This science of regenerative medicine using stem cell is very exciting. It's some of the most exciting science out there in medicine. But what we are doing is we're actually taking bone marrow donations from a very young adult, usually around 18 to 20 years old. And this is a fairly simple procedure at this point. They take a very small aspiration of bone marrow. And so this is consenting adult donors who are compensated. Now, this goes in through a protocol where the donors are very carefully vetted. Of course, they are tested for, any kinds of issues so that we make sure that we have pure, pristine bone marrow coming into the lab. And then the cells are removed and sorted, and they become our factory. And that's what's really cool about this.
This is what I want you guys to know, okay? It's not the direct stem cell, even though I say it's stem cell therapy. It's the secretions from the cells that are producing these baby secretions that help with inflammation, help with remodeling. It's all of the growth factors and the cytokines that come from those cells, because people are getting nervous about that. I'm going to answer a couple of questions really quick, then we'll continue. By the way, love to India. Thank you guys for following all the way in India. They said they love the products. One of the things people always ask me is, can you use these products with things that are active on the skin? And I always tell people we combine antiaging growth factor stem cell cytokines with peels, with lasers, because all of the products are antioxidant, hydration, and anti-inflammatory. And so even in my big peels like Cosmetic and Enlighten, I have a post-care protocol that makes people use Antiage, both products, twice a day. Mm-hmm. And that you would be stunned at how quickly people heal, but how it doesn't affect the results of the peel at all. It still stimulates, it helps proper stimulation of the cell turnover, because it's regulating things to work properly with decreased inflammation. Those with sensitive skin like rosacea, even those that have acne that are on Accutane, they should be using this product because their skin is really dry, it's irritated. The product plus LED therapy and other actives if needed will really help speed up the healing process, because you have these amazing secreting cells that are producing targets that you need to stimulate your body to heal. And so talk to them a little bit more. You have these cells, now they're being grown in a lab, and they're secreting what things?
We call them growth factors and cytokines. So these cells, while they're alive and happy.
John, welcome. We have a celebrity here right now, actually, who's currently using your product, Sean Vanderwilt. You guys should all follow him. Very, very successful choreographer for Cher for many years. and now has many things going for himself, but he just did a peel and is currently using all your products.
Fantastic.
So we're going to get him to go live with you very soon. But yeah, go ahead, talk more about it. Explain to them why this would be, and thank you, the Skin Scientist. I know it is a great idea. Thank you so much. We've been using it for years. It helps like you wouldn't believe. We need a lip product though, although I put mine on the lips anyways. So yeah, go ahead. So keep going.
So these cells, these bone marrow stem cells, adult bone marrow stem cells from consenting young donors, they become our factory for these natural human proteins. And so what goes into the products that you're mentioning, the Antiage serum, is not a human cell. It doesn't have DNA. It's not weird. We just use that as a factory to grow these very important natural proteins that we all have in our skin. And those proteins are identical from me to you, Jason. They're the exact proteins. And so we use them, we actually nano encapsulate them because they don't tend to survive very well if we don't protect them. So we nano encapsulate them in these little nanolipid envelopes, and then we can put them in solutions that we can put onto your skin, whether it's on a daily basis, whether it's a high potency treatment product that you're using with your laser, with your RF, with your peels. And so those are the heroes. And what can they do? Well, yeah, they regulate inflammation. We talked about that. They stimulate healing. One of the things they do is they regulate scarring and fibrosis.
Oh yeah, which is phenomenal. That's why I believe post-laser it's essential to have that, because there's always a risk, no matter what, of developing either little keloidal scarring or irregular texture with a very strong laser. You know, I do very aggressive acne scar treatments, and we look at the transitions. And you can see on my Instagram at Jason Emer MD, we show a lot of transitions of aggressive laser, and you see people at day 3 to 5 healing is what I would have thought they would have healed at 1 to 2 weeks because of using these technology and my post care. And sometimes I won't even do treatments on patients unless they agree to follow it. And my staff will tell you about 95% of my clients, they follow everything to a T. The other 5% will sign a waiver and they'll be unhappy that they didn't do it because they're in pain, there's more swelling, there's more redness, there's more flaking. If you follow these protocols, you heal much more quickly. I want people to know more of the consumer side. I'm the consumer guy, and used to be, I came from a scientific background, fellowships and doing all this, and then I realized people just want to see results. And the reason I'm showing you, you know, my skin, yeah, everybody has little dark circles. I'm almost 40, I have a little fine lines, I have a little birthmark that's coming out, I have some fine wrinkles, but for my age, I look really good. And that's because for years I've been using retinol. For years, I've been doing peels and lasers, which is what you need to do regularly. And then about 10 years ago, when peptide and growth factor therapy started coming out, originally from human foreskin stem cells, and then coming from other different cultures like plants, now we're at human bone marrow, we're upping the game to our anti-aging. I tell people to do twice a day using both products. If it's irritating, I truly feel like it's extremely important to always be getting your skin to remodel and giving it food, fertilizer for the lawn is what I say. So in these products, specifically the accelerator, having the hyaluronic acid, having other antioxidants in there, and then for those that are kind of allergic or irritant to retinol, explain the active ingredient there and where you found it and how you know that works.
Yeah, so the bakuchiol or bakuchiol is...
I know I say bakuchiol.
Yeah, it's easier to say it that way. Is a plant-derived chemical that it behaves very much like retinol. So it isn't a retinol, but it actually stimulates the skin in a way that at low doses is almost identical to retinol. So if you're, you know, I'm sure that you prescribe for patients with certain skin issues some very potent retinols, and you should continue using those, right?
Oh yeah, we always do. And you know, I'll tell you, in those with medical conditions like melasma or acne or post-laser, or I want to stimulate the peel to work faster, I actually use a strong retinol at the same time. Then what we'll do is maybe a couple days a week they can use the stronger retinol, but they continue to use this treatment all the time as a quote retinol alternative. I love this Skin Scientist over here talking about the receptors for retinol. And just so you guys know, yeah, I mean, this product binds the receptors, acts similarly to a retinol without the irritant. property. You know, 15 to 20% of people are actually allergic to certain dyes and certain fragrances, and also certain ingredients like cinnamon, for example. But the same number holds true for retinol and vitamin C. So if you have it in the right barrier or medium to go onto the skin, it limits how irritating it can be. But some people, no matter what, will have that allergy. So they either push through it and try and get sensitized, or we do it staggered, which is what Jen Woodburn is asking right now. I would then have them using this for a while, and maybe once or twice a week a stronger retinol with it or without it. But I like to have that a little bit more of that strong turnover if I can, because of the science. But if we can't, this is a perfect alternative, because you're getting not only that, but you're also getting all the cosmetic ingredients like the hyaluronic acid, vitamin C, coenzyme Q10, vitamin E, all of those other products in there.
Yeah. Yeah, so the bakuchiol in the accelerator. So, you know, our
Can you show the accelerator? Can you show them?
Yeah.
Oh,
so
yeah.
This is the accelerator.
Turn a little bit.
This is actually step 2. So our skincare system is step 1, step 2, serum and accelerator. The serum and accelerator are designed.
Show it like this a little bit.
Yes.
So they can see.
I'll give you the consistency on that accelerator.
Yeah, I want them to see. Go a
so
little hot.
So I'll start with the step 1.
That's fine.
Generally,
yeah,
we want people to start with step 1.
And I also want them to know, what does step 1 stem cell growth factor cytokines typically smell like?
Yeah. Typically, so if you've experienced other growth factor products, they may have a very strong, we'll call it biological smell.
Woo!
Yeah,
that's true.
Now, there's a reason for that. You mentioned that there were some older stem cell technologies out there, and older cell medium technologies like fibroblasts from circumcision foreskin donations, right? That kind of product, to have any efficacy at all, they have to put in about 90% of the conditioned media. That means 90% of the fluid that came from the stem cell culture has to be in the bottle to do anything. They need that concentration, because those
what does that smell like?
Very strong. Now, working with bone marrow stem cells, we're able to get actually about 40 times. So, you know, whatever that is, like 4,000% more potency out of the growth factors and cytokines versus the older technology.
Well, I'll tell you, that says a lot, because you're similar price, okay, if not less in price, but having a better scientific, better science, better smell, and probably even better results, because we're up to date. You know, one of a Clear Skin Studio here is saying we can avoid 6 to 7 products and just do 2 steps. Exactly. Listen, I'm going to do a scan of my bathroom this week, and I have like 20 products. I still believe in doing everything for everything. Thank you guys so much. Thank you, James. I love my new haircut. I've been using the Antiage in my head, because again, you get sun damage in there, so you got to be careful. I will go through pregnancy and oncology in a second. But what I was saying is for the price, if somebody had to limit what they did, you could have these 2 products and get almost all the components of anti-aging needed. Now, if somebody had very severe acne or melasma or deep wrinkles, we need to add some other things. But they could do the micro-rolling protocol once a week at home and get a concentrated version of stem cell with manual collagen induction, and get more production of without product. They could do a treatment.
Sure.
But in general, you know, I am doing something for the eye area. I am doing a hydrator, using a couple hydrators, actually, a soft one and a thicker one. At nighttime, I do active products for pigment, and morning for acne. So it just depends. And then what is your opinion? I'll go to the medical part. What is your opinion on pregnancy and cancer?
Yeah. So, you know, we've been doing this for about 11 years now, and these products have become very well studied. And we've actually worked with a couple of professional organizations that have evaluated our ingredients, and we actually have some certifications being oncology safe, based on the science behind it. And in terms of breastfeeding, you know, because we now no longer even use a retinol, we're using that bakuchiol.
Then
we really brought the profile down to being very effective, high potency medical skincare. But it's also, it's very safe and gentle, and there's not really any concern about these ingredients with
Oh yeah, I
how
mean,
well understood
just
they
so
are.
you know, I, as a medical doctor, am not concerned about use during pregnancy, breastfeeding, or chemotherapy. I really think you need to be on these medicines when you're getting chemotherapy because it severely dehydrates the skin. It damages collagen and elastin, and you get a lot of sagging and change in pigmentation from hormonal changes.
Yeah.
I believe in the micro rolling protocols that I've talked about. High peel, we love micro rolling, I know. Um, and I believe in them doing those protocols during pregnancy, etc. I might avoid deep peels. I might avoid certain lasers, even though there's no studies on that. Probably a really strong retinol, even though I don't truly believe it would harm someone's baby putting a retinol on your skin. Just to be safe, because of the category it's in due to Accutane, I
Yeah.
wouldn't do it. But vitamin C and bakuchiol and vitamin E and growth factors, stem cell growth factor cytokines are fine, and I think it really makes a big difference. Some people, they're asking about red and heat. You know, this is what I always tell people. When you start a skincare product, regardless of niacinamide that's in the product, but the amount that's in there is too little to cause somebody to be truly flushed, you may have a little allergy or time that needs sensitization to a product. Even the growth factors and stem cells can often cause a little purge of acne, and then it improves. A lot of studies have been shown on that with other growth factors. With that said, you got to give products 4 to 6 weeks. You got to continuously apply. If you get really irritated and red, take a day or two off and go back in with a little less. I showed last night 1 or 2 pea sizes for a full face and neck is all that's needed. So much people will put way more on, causing the allergy, initiating the irritation. You shouldn't need that. With the hyaluronic acid, with the vitamins in there, you should be able to have a very soft, subtle result that's not going to be irritating. And so if you got red and bumpy, it could have been what we call an early dermatitis, and that can be treated by consistent use. You can always add it to a specific moisturizer. We've been using some lighter moisturizers from Japan lately that are completely devoid of any actives, really help just calm things down for people if they need it, especially in the areas like the eyelids and the ears, because I put everything there. I do lips, nose, eyelid, ears, and then I rub everywhere, my neck, chest, everything, because anywhere that's exposed to sun, the hands, all should be treated. And yeah, and I think it's safe. And we have somebody here saying they've been telling patients to use rollers since needles cannot penetrate the skin at a 90-degree angle. Is this correct or not correct?
You know, I've got an opinion on that. I know that you work with rollers, as do we.
But I do like stampers, so I want you to talk about that because your at-home treatment.
Yeah, we do a stamper as well.
Yeah, before that came out, you guys, just so you know, we used to do rollers and stampers that we would purchase and tell patients to use the Antiage microneedling solution or hair solution to their scalp. When they were doing their face, if they didn't want to do their scalp, I at least had them do their hairline, especially men with their beard and women with the hairline, because a lot of women will lose the temporal area and the midline part, and men obviously lose more in the back at first, besides this widow's peak area. Long story short is, show them the stamper, because what you're asking, Schwan, is that these are 90 degrees, so that's not true. You can do a vertical angle or horizontal angles, but a stamper is easier in hair, much easier.
I would agree with that. And that's why we like rollers too, and so we work with rollers on the face. We think they're great. Now the 90-degree angle question, I think that's important if you're talking about a roller that's 1 millimeter, 2 millimeters deep, and you're going much deeper. You need to be very careful about the quality of those needles at those depths.
I agree.
Now, when you
that's why you do those at a doctor's office.
Absolutely, absolutely. Now, when you're working in the epidermis and even just the stranocorneum, this is at basically 0.25. So the rollers that we actually do for home use tend to be around 0.25 millimeters.
Okay, and mine are 0.5, but 0.25 around the eye. I think that at that level is okay. Anything above, I think, needs to be in a doctor's office. There's too much risk and you could hurt yourself. They're asking about if somebody had hair transplant, they should be doing this immediately, you guys, immediately. I tell people to start putting on the application of the product right when they go home, even though my friends that all do hair transplant yell at me. I don't really care. I tell them to do it. We've been doing it for years. I actually was taught in New York by a very famous hair transplant doctor, and I'll call it Robin Unger right now, one of my best friends in New York, who's an amazing hair transplant surgeon, just quite phenomenal woman, very bright. And, you know, she would kind of look at me strange when we first started, but then when we saw no issues, less telogen loss of hair in the early phase of hair transplant, because sometimes you can lose the hair in hair transplant. They get stressed out, and then they come back. This, I think, helps limit that and improve the results. And I think it should be done. So your protocol for at home for face and head is how often?
Yeah. Generally, we want to see you doing it multiple times a week. So 2 to 3 times a week is pretty normal for an at-home protocol.
Beautiful.
These needles, because like we said, the depth is low enough that you're not really doing damage, you're not drawing blood, you're not into that vascularized dermis.
Exactly.
Then what you're doing at those higher levels is you're increasing penetration and you're stimulating keratinocytes, right? And that's really important. So actually in the scalp, we're increasing penetration of the growth factors. So we have a few different hair growth factor products with some different combinations, some different strengths. This is one of them. We actually, I'll tease this out. This is a product that's coming out in about 6 weeks.
Ooh, I didn't know if you were going to tell them. Love
new
it.
ANTIAGE MD hair serum coming out.
Great.
It's in this really cool little dropper.
Love it.
And it actually combines 2 products that we have been working with, which is a botanical and a growth factor. So we're going to a simplification, but we can still use the stamp, or we have a new scrubber that we've developed that stimulates the scalp. So you can use this to really stimulate blood flow. And so
they're getting excited. You just got a little boost in followers. They're getting excited. They're also asking me if they can use this serum in the AquaGo cocktail. Obviously, off label, I do that very frequently. We will add in our what we call microampule infusion. So it's basically ampule induction. AquaGold's 0.3 millimeters. We're talking about a 0.25 stamper. I do 0.5 rolling in the office over 1. Antiage is saying you have great customer service. We love them. That's why I'm here. And we're going to be doing a collaboration this year too. So get ready. You guys are going to be extremely excited. I think it's going to be very successful. With that said, in the microampules, we will put in active products for pigmentation or acne. We'll put in hyaluronic acid as a filler, which is also in the Antiage products, and vitamins, which will use something that has 108 different vitamins in it, and then often Botox, because it actually helps redness, sweating, and I think it also helps hair growth, to be honest. But the cost of it for the scalp would be crazy. And this is a trick I never tell anybody, sometimes I'll add Latisse. And we'll do that in beards, in eyes, and in scalps. We find it very effective. And just so you guys know, Peel that's on here, my esthetician, is like the queen of AquaGold or microampule infusion. She literally does people's whole bodies. It takes her hours to do it before red carpet events. It's insane. They'll come in every day for 3 days, do 3-hour treatments of their whole bodies, but they glow for a week. And I think it'll be great for her to get this stamper and make videos of this protocol, because everyone likes to see. She's very medical. You guys are very medical. The science is there. Everyone's going to really want to see in detail, up close and personal, how do we do this procedure? When do I do this procedure? I think we're going to probably want to do these things in things like eyebrows, the full hairline, and men's beards. I think that's going to be a big deal. But I'm very excited about that hair serum. I think it's going to be great, and I think it complements the in-office treatments we do with the PRP, with ASOL, stem cell products, or other things that we do injectable-wise, until we have something more synthetic that we also can inject.
Yeah, exactly. And those are things that we're working on. And I
know.
Once we are able to travel a little bit more freely to get you down here to Orange County and show you some of the things we're doing in our R&D lab will be fantastic.
Yeah, it'll be really, really great. And everything they're saying here is all of the results temporary. You guys, if you go to the gym every day for years, you look great. The second you stop, which is COVID basically, you don't look as good. So I always tell people, yes, you're going to need to do lifelong treatments for everything you do. If you want to look this way at 40, you got to be doing treatments since 2006, like I've been doing since I was a resident. I've been doing lasers every 2 months for years. I've been doing micro rolling at home. I have like 15 skincare products I use almost every day. So you've got to be consistent. So when people say that, I go, you know, you're not really a part of this long-term plan. You're gonna age. You're gonna lose hair. You're gonna get saggy. The question is, can we make it stop earlier in life and make you look better as you age? We're getting near the end of what we need to do because we don't want to go too long on live. Otherwise, we won't be able to show it on IGTV. Right. What other things do you want people to know? I think we really went over, and I'm going to do another live later. I'm going to do a secret live later today and talk a little bit more for people that want to ask questions. So all you guys on here right now, make sure you pay attention this next 24 hours. But what else do you want people to know? We need them to start following you. We need them to follow you because there's new science that's coming out. With everything they do, this is basically a product that can be added to or be as a starting point, right? Yeah. And then also those people that don't do at-home treatments, we really think they need to start doing that for the face, for the hair. You have an amazing protocol beyond any other company I've ever seen. And there's a lot of good science behind the ingredients in there. So we got to be doing it. So all these nurses, estheticians, and doctors that are following, you need to contact them, get those microneedling solutions, get the hair serum when it comes out, get the hair ampules. This is really important to start to get your patients to do beyond the dual treatment at home.
Thanks, Jason. Yeah, so you can follow Antiage. Our handle on Instagram is Antiage Skin, ANTEAGE Skin. We've been talking about, our flagship products, which is the Serum and Accelerator, 2-part system, 18 active ingredients. It simplifies your medical skincare regimen down to 2 parts that you can easily do a couple of times a day to really make sure you're getting everything your skin needs to be healthy and stimulated.
Yeah, and if you weren't able to do anything else and you wanted anti-aging, but you also wanted glow, you also wanted a little tightening, shrinkage of the pores, that's a good starting point. Anyone that has active disease of acne, rosacea, pigmentation, we're going to need to add a few more things. We may need to do peels or lasers, but they're going to heal faster. Their skin's going to be less sensitive. It's going to work really well. It's going to make a huge difference for them, especially post-therapy. And then, guys, I just really want you to follow along over these next few months. Collaboration between me and Antiage, plus the products that they have coming out. It's going to be a big year once COVID ends. And even now, if your patients aren't able to get the products, let us know. We can get them. And I can send you some information on what we do in the office. So is there anything else you want to say?
I think that's it for now. We've got a lot more to talk about in the future. So I appreciate your time today and really.
So it'll be great. And then remember, I'm going to also have you guys be a guest on my live in the next week or two. So coordinate that with everybody. Thank you guys so much for following. Make sure that, Antiage, make sure you save the live. Okay, yep. Save it and share it.
We'll make sure it gets
We're going to make it up, put it up so everyone knows. And then keep following over the next 24 hours. They're going to put product highlights up on the Instagram story. And then I'm going to pop in sometime later today to give you some expert tips. Bye, guys.
All right. Thanks, Dr. Emer.
You got it.
Bye-bye.